question. It's got some stick diagram of somebody doing a press up, position A, position B. Quick diagram asks for naming the main agonist and the main antagonist. Agonist is the working muscle, antagonist is the opposing muscle, and it's looking at the movement from position A down to position B, so a downward movement. Name the type of muscle contraction that occurs, the main agonist at position A, while the gymnast is stationary. So we've got moving muscles to be named, but also stationary muscles. And then right at the bottom, planes and axes. Okay, let's try and get some information about this sort of question coming through. In upward and downward movements, and there are only two that might be asked. One's going to be the press up or push up. One's going to be the squat. They're the two bits of movement that are actually in the syllabus. So if there's no movement, what type of contraction is it? You should be thinking now it's an isometric contraction. Isometric means no movement. And an upward movement, that's a normal movement. That's normal. Normal movements are called concentric contractions because the muscle normally shortens. It's just when gravity interferes with the movement and is a big major aspect of the movement, we can get downward movements where gravity has to be controlled. Those sort of contractions are called eccentric contractions. So isometric, concentric, eccentric. If you want to, you can also use the word isotonic as a movement contraction. Isotonic is the group name for concentric and eccentric contractions.